Yes, doctor, since there are some participants now, we'll start the program. I'll first give an introductory session. Actually, hello everyone who are participating today. I'm Umesha Hemasingha, a member of the Director Board of Ceylon Association of Medical Acupuncturists. First, I would like to tell you all why we as Ceylon Association of Medical Acupuncturists thought of conducting an online session regarding utilization of acupuncture for substance use disorders. Actually, acupuncture is a widely accepted alternative medical system in the world. However, in Sri Lanka, acupuncture is still gaining its popularity. But we have seen that, like now, many Eastern as well as Western countries are integrating acupuncture to their healthcare systems to treat various health issues and disorders. So, substance use disorders are one of the most substantially treated conditions utilizing acupuncture in both drug detoxification and rehabilitation. And like in majority of the countries, substance use disorder is a major issue in Sri Lanka as well. And more young individuals are using substance, and now it has become a major public health concern. In Sri Lanka, there are government as well as private rehabilitation programs that use various effective therapeutic methods to treat substance use disorder under the control of the National Dangerous Drug Control Board, which is the pioneer government authority in charge of prevention, treatment, and rehabilitation of substance use disorders in Sri Lanka. Like I said before, other countries already use acupuncture effectively to treat substance use disorders. So we believe that it would be beneficial to use acupuncture treatments to bring about additional benefits to the already existing treatment programs in Sri Lanka as well. And that's why we thought of conducting this session as an awareness program regarding the utilization of acupuncture for substance use disorders. And I have to say that we are very honored to have members of the National Dangerous Drug Control Board and the members of KIU Cell participating for this session today. And I welcome all of you participants from Sri Lanka as well as abroad for this session. Now I will introduce to you our honorary speaker, Dr. Libby. Uh, Actually, Dr. Stuyt is a board-certified addiction psychiatrist, and she has worked in the addiction and behavioral health field since 1990. She was the medical director of the Circle program, and a 90-day inpatient treatment program funded by the state of Colorado for persons with co-occurring mental illnesses and substance abuse who have failed other levels of treatment from 1999 to 2020. She retired from this position in May 2020 in order to spend more time attempting to educate as many people as possible on the unintended consequences she has seen from the commercialization of marijuana in Colorado, uh, focusing primarily on the deleterious effects of hyperintensity THC on the developing brain and mental health. So, Doctor, I will hand over the session to you now. Thank you very much.
Okay, thank you. I'm very happy to be here. And I will share my screen. And just let me know if you can see it. You can see it, yes?
Not yet, Doctor.
Hmm. Hmm.
Yes, ma'am, I can see the screen.
Okay, good. Thank you. All right. I'm very happy to be here. As you know, acupuncture has been around for thousands of years, and the points have been known for thousands of years, the acupuncture points along the meridians. I just think it's fascinating that Western science has been able to show that these actually exist by showing that there's decreased electrical resistance at all the points. The use of the ear is relatively new compared to full body acupuncture, and that was mainly started in France, as you most likely know, in the 1950s by Dr. Paul Noget, who figured out that the entire body could be accessed in the ear. There are points to treat all of the body. But the use for addiction treatment is even more new. I mean, this hasn't been around that long. And the way it was discovered was very serendipitously by a neurosurgeon in Hong Kong. His name was Dr. Wen, and he was using electrical stim ear acupuncture on the lung point as a preoperative analgesic to help people calm down before they had surgery. And he noticed that when he had people that were addicted to opium or heroin, that they did not have withdrawal when they were in the hospital. And so then he recruited people with opium and heroin problems and found that he could detox them just using ear acupuncture. And this got published in a scientific journal, and then there was an article in the New York Times about it. And what I like is this quote that they say they don't claim it's a cure for drug addiction. If they can treat the withdrawal symptoms, make the patient more comfortable, and alleviate their suffering, we have achieved something. Our treatment is not the complete answer for addiction. So this is definitely not a standalone treatment, but it's a very helpful aid. What was interesting at the same time, so in the 1970s, at the same time in New York City, in the Bronx, there was a very severe opiate epidemic. And heroin overdoses were happening all the time. Methadone was discovered in the 1960s and then became a treatment for opiate use disorder. And Lincoln Hospital in the South Bronx was one of the very first programs to start using methadone maintenance. However, the people that lived in the community, and the reason the rest of the world didn't really hear about this opiate epidemic was because it was affecting primarily people of color. So it was people that were African American, and these were people that had moved to New York from the South of the United States. And then the young lords who were Hispanic, that were mostly from Puerto Rico, who had moved to New York. And they were not very happy with methadone. They felt like it was a way that the government was trying to control them. And so Lincoln Hospital was the hospital in their area. It originally was opened as a home for the quote colored aged, and it became a school to train African American nurses. But it was known as the butcher shop because it was not a very nice hospital. There was lead in all of the pipes, and children got lead poisoning in the hospital. They said they had rats in the emergency room, and so, and what they said was that there were people dying of heroin overdoses. And this became a search for affordable quality health care. And what actually happened was the young lords and the Black Panthers basically took over the hospital. And so it was a gentle takeover. They just said they occupied the hospital building and then they made demands. And they were basically demanding good health care that they felt was their right. And this is the first people that were actually saying that healthcare should be a right. And when they read in the newspaper that Dr. Wen in Hong Kong had found that ear acupuncture was helpful, then they asked if they could start doing that. And so that actually began the Lincoln Detox program. It became an outpatient methadone detox program rather than methadone maintenance. And they included ear acupuncture. And so it was run primarily by the Young Lords and the Black Panthers. And there's a very nice video, documentary that I encourage you to look at. And I will give you a copy of these slides so you can look at that link there. Dope is Death is a really fascinating documentary that kind of covers how all this happened. Because there were many people involved in this, and there were activists. So Matula Shakur, he was not actually a member of the Black Panthers, but he was a member of another organization, and he was pushing for political change. And all of these people in these pictures were instrumental in getting this going. And so there were they had acupuncturists come into the program. Some of them went and got trained to be acupuncturists, and they started using the ear acupuncture with the lung point, as Dr. Wen had pointed out. And over time, they came up with these 5 points. So there's 5 standardized points. And they also found that initially they were using electrical stim, but at one point the machines kept breaking and they didn't have them. And they found that manual stimulation was better. It was more tonifying and it produced a better effect. And that's true in general. If you like you all have just been trained in acupuncture, if you have an acute injury, many times you will use electrical stimulation on the needle to encourage healing process. However, if you have a chronic illness, the manual stimulation seems to work better because it improves strengthening and tonifying. So this Matula Shakur was actually recruited and hired as the director of political education, and this was a very excellent treatment program. It was outpatient. They had a huge room that had like 200 chairs where they could treat 200 people at a time, and the requirements were that you came every day and you participated in the program. And one of the groups was a political activist group that Matula Shakur led. And these were really inspired by the barefoot doctors out of Maoist China, who were just young people that were trained to use some acupuncture and some other medical provisions to help people in the countryside where they didn't have doctors. And so it was kind of interesting in the fact that pretty much everybody who was working in this program were either African American or Hispanic. However, the physicians were all white. And there was a case where in 1974, the physician running the program, Richard Taft, was actually murdered. There's a dispute about that, but what was happening was the government wasn't really happy about all these political activists. And there's some thought that he was murdered. The problem was he was found dead in a room with a needle in his arm, and he had never used drugs before, and so it was very unlikely that he actually had an overdose. But anyway, that was a bad thing that happened, but they persevered, and as you know, I'm sure they came up with these 5 points. So you get 10 needles, 5 in each ear. And Michael Smith was an intern when Richard Taft was in charge. And Michael Smith ended up taking over as the physician. He was a psychiatrist. And he then created the National Acupuncture Detoxification Association in 1985. And that's when they started doing trainings. They adopted the term AcuDetox to differentiate it from other forms of acupuncture because they were training people that were not acupuncturists. And as we have experienced in the United States, acupuncturists tend to be somewhat territorial, and they don't like other people taking over their medicine. So we've had many changes in many state laws to expand it to, like in Colorado, now anybody can learn to do this protocol and use it, which really helps expand it. And it has helped the acupuncturist because it's introduced people to acupuncture, making them much more interested in it. Anyway, the Lincoln Hospital, the Lincoln program became this center for training, and people came from all over the world to get trained there. That program was closed in 2011, mainly due to managed care issues, money issues. And so we have created trainers that are all over the United States in different states, and they do the trainings. And then when people take the training, they become what's called an acu-detox specialist or an acupuncture detoxification specialist. And in many states, as I said, anybody can learn to do this. Other states are very limited in who can do it. Now, I kind of want to go into the research behind this just to support it. It has really been spread primarily by word of mouth. This is mainly because there's no money behind it, as in pharmaceutical money. You know, pharmaceuticals get pushed a lot because they gain a lot of money. Nobody ever got rich doing the NADA protocol. However, it has been found to be a very useful tool in treatment of many other areas, not just substance abuse. Because of that, well, this is the organization in the United States that monitors treatment programs around the United States. So they do these surveys every year. And I ran this program for 20 years, and so I filled out the survey every year. And this is old data, but it hasn't changed much. This is just showing that in 2012, they surveyed of over 14,000 programs, and they found that only 628 programs reported using acupuncture in their program, which means that not that many patients have actually been benefiting from it. And this is because it, like I said, it's spread by word of mouth. And most of those programs in 2012 were actually high-end programs that were providing full body acupuncture. And what we're trying to encourage is that all programs should have this NADA protocol that doesn't require to pay a full body acupuncturist to do it. This protocol really took off around the 2000s, and this happened because of 9/11 in 2001 when we had the bombing of the buildings in New York City. And what they found after that was that NADA protocol was a very helpful tool for stress reduction, and it helped people sleep. And so we have been using it a lot after disasters because it is not a standalone treatment to help treat post-traumatic stress disorder, but it can be a standalone treatment to prevent PTSD. Because what we do know that what causes post-traumatic stress disorder is someone not sleeping after a trauma. So that doesn't allow the brain to digest those memories, and they kind of get stuck. So we've seen a lot more use of it now for trauma. This is a very difficult thing to study in the gold standard Western medicine idea of how you prove something works, because the gold standard is randomized, double-blind, placebo-controlled trials. And you can randomize, but it's very difficult to blind. It's difficult to blind the recipient, but it's impossible to blind the therapist because, as you know, there is intention involved with putting the needles in, and this is an energetic treatment. And so that when you're putting the needle in, you have the intention that it's going to help because you know what it's supposed to help. And I just imagine if you're trying to do a research project where you're putting it in the wrong point, your intention, your mind is going, well, this isn't the right point. But anyway, um, this, however, there have been some placebo-controlled studies that have been showing promise. The very first one was done in Minnesota out of the 28-day model treatment program, inpatient residential program that's 28 days. And they were looking at how do we help those very severe recidivist alcoholics, the people who just can't stop drinking no matter what you do. So they randomized them. 40 people received the NADA points, 3 of the NADA points, and 40 people received sham, which was about 5 millimeters away from the treatment points. And what they found was that in the people that got the NADA points, 21 of the 40 completed the program, whereas only 1 of the 40 in the control group completed the program. And at 6-month follow-up, more people in the control group expressed a moderate to strong need for alcohol. And they had more drinking episodes and admissions to detoxification centers. So this was the first study that got people's attention that said, well, this might help with retention and participation. And so a similar study was done with heroin addicted people. This was looking at 100 heroin addicted adults that were not on methadone maintenance. They were randomly assigned. The people getting the NADA points, they got 4 of the NADA points, and the control group got sham acupuncture that was 5 millimeters away. And they found the same thing, that the people that got the NADA points were more likely to complete the detox period and then return for additional treatment after the detox period. So this was something showing that it really does help with retention and participation. This did get the government support, and so there has been a SAMHSA tip. So that's our national organization that controls substance abuse. And so tip 45, which is the final tip that came out, supports NADA as an evidence-based adjunctive treatment in substance abuse treatment. This was a really definitive study that came out that was really supporting the use of the NADA protocol. It was a well-designed study. It was done at Yale University, and they used, it was a naturalistic study in the fact that they were using people in their treatment program. And they were looking at people that were methadone maintenance people for heroin, trying to figure out how to get them to stop using cocaine. And if you've ever worked with somebody on methadone maintenance, they frequently will use stimulants because the methadone is so sedating, they have to have something to counteract that. So people on methadone maintenance often use cocaine or methamphetamine, and that's a problem. And so what they did was they randomized these people into 3 groups. 1 got 3 to 5 of the NADA protocol points. 1 got sham acupuncture, and these were now just on the helix, so just on points, related to the spine. And then the 3rd group was a no needle relaxation control. And then they looked at urines, and so they got quantitative data, and they found that the NADA points significantly more effective in reducing cocaine use than either the relaxation control or the needle and sham control. And they were more likely to stay longer in treatment and more likely to be abstinent and completion if they got the NADA points. Now, this was when I heard about this. So this is when I started using this protocol in my treatment program. I came to my treatment program in Colorado to make it tobacco-free. I've done a lot of research on this. I've published a lot. I think that in order to have the best outcomes, residential and inpatient treatment needs to be totally drug-free, including tobacco. And so I read this study and I started using it in my program, mainly to help people quitting tobacco. But what happened in the United States is Western medicine, in their infinite wisdom, when we have a positive study, they decide that they needed to immediately replicate this in multiple sites around the country, which they did. And so they had 620 patients in 6 sites throughout the US. And the sad thing is, they reported that the NADA protocol was not any more effective than sham or relaxation control in reducing cocaine use. And so they concluded that the NADA protocol is not a standalone treatment for cocaine addiction. And what's really sad is nobody ever said it was. This is sad because it was a watershed moment when much of the NADA research and applications stopped. So one of the groups who had been involved they were initially in the first Yale study, and then they were involved in the multi-site study. They published an analysis of what had happened. And the big problem was the Yale study was a naturalistic study where they looked at their patients and they just added this one treatment, and they were all in treatment as usual. The multi-site study, these people were not in treatment. They were recruited by advertisements in the newspaper, and then they were paid if they showed up and submitted urines. And they really didn't have treatment. And so this was not at all a study of like what it was before, but still it caused people to not have that much interest in it. In spite of that, people did continue to study it. And this is a really nice study looking at the benefit for smoking cessation. And so they compared the NADA protocol alone to the NADA protocol plus education and counseling to sham acupuncture plus education and counseling. This study again showed that the NADA protocol alone is not effective, because for the people that just got needles, only 10% were off of tobacco at the end of the year. And that's worse than anything else we have for tobacco. What they found was those who got sham acupuncture and education and counseling, 22% were off tobacco at the end of the year, which is similar to what we have for nicotine replacement therapy research. Those who got the NADA points plus education and counseling, 40% were off tobacco at the end of the year. And that is very similar to what Pfizer publishes for their Chantix results. I actually attempted to do a research project. I applied for money from Pfizer to compare Chantix to NADA protocol, and they were not interested in funding that research, interestingly enough. This is not the NADA protocol. This is a different protocol, but I think one or two of the points are the same. But this is showing that auricular acupuncture for dental anxiety really is helpful. So what they did was they randomized patients to their auricular protocol, placebo auricular protocol, and then intranasal midazolam, which is a benzodiazepine. And because when you work with people that have addiction problems, one of the biggest problems that comes out of their use of substances are dental problems. And this is true for alcohol and all the other drugs. And so these people have significant dental problems, but they also have significant dental anxiety, and they don't like to go see the dentist, and they don't like to get the treatment. And the big problem is the dentist office is a very big place for relapse, because very few dentists understand addiction, And so they do some kind of procedure on the person, like a root canal, and then they automatically give them a prescription of opiates for like 60 pills. And where most people may only take 1 or 2 pills, but then these people have a whole bottle of it. So that's a big relapse area to happen. And this study actually found that the auricular protocol was as effective as intranasal benzodiazepine without the side effects of the benzodiazepine. So I actually used this study to try NADA at my treatment program at the state hospital because we had, I mean, it was a wonderful program that I ran for 20 years. It was a program that was funded by the state of Colorado, and it was 90-day inpatient treatment, which is phenomenal. Most people don't get 90 days. And we had full service, like we had a medical team and a dental. We had a dentist, and we had a wonderful dentist who saw all of my patients. And he was able to do pretty much all procedures without any opiates because he used mostly high-dose non-steroidal anti-inflammatories. However, he frequently asked me for benzodiazepines because of the anxiety that people couldn't sit in the chair. And I really dislike benzodiazepines. I don't like using them. And so I asked him if I could send a nurse with the patient, and she would put the needles in the ear, and they could sit in the chair and have the procedure. And he said, sure. And so that's what we ended up doing. And it worked perfectly because the nurse would use the NADA protocol and the patients would be calm and relaxed and able to do the procedure. And it really helped with self-efficacy because the patients would come back very proud of themselves that they went to the dentist and they did it all by themselves. It didn't require any drugs. There are studies now, this is just showing that treatment programs can save money by adding the NADA protocol. This is a private program where they compared a group of people who went through the program without the needles, and then the similar group that went through the program with the needles. And they found that at 6 months follow-up, the people that got needles had higher program completion significantly, higher rate of negative urines, fewer inpatient rehab days, and they were able to save almost $2,000 by having the simple protocol in the program. There haven't been really many studies looking at, well, in the gold standard of looking at psychiatric symptoms, but there have been more and more coming out. When I first got into this, I was a Western trained scientist, so I was somewhat skeptical. And I knew that I would need to collect data. And so when I started doing this in January of 2000, and well, I started using it in January of 2000. No, I take that back. We went tobacco free in January of 2000. I started using the NADA protocol in November of 2000. And so we started the study with all the patients that were admitted between January 2001 and December 2003. And we had about 440 patients that went through the program. And we found that our successful completion rate was not that great. This was 56% actually successfully completed the 90-day program. But the people that did complete had about 90 days average. And even those who dropped out early still had longer than most people have in treatment, like 38 days. This is a program, sadly, does not exist any longer, but it was around for over 30 years. And we treated anybody 18 to 65, and the majority of them were there as a condition of probation due to legal problems that they had. But it was funded by the state of Colorado, so they didn't have to pay for treatment. It was totally abstinence-based, a very intense cognitive behavioral program that was totally tobacco-free since 2000. And we had a lot of people with access to disorders because if you work with these individuals, these are the people that get kicked out or drop out of treatment. Um, and so these are people with borderline personality disorder, antisocial personality disorder, narcissistic personality disorder. They don't do well in treatment and they get kicked out or dropped out. And so that's why we had so many of them, because we were treating people that have failed everything else. We found that when we started using the acupuncture, most people really liked it. And we found that the people who used it were more likely to complete the program and stay longer periods of time versus those who didn't get the needles. And they found that for the people who got the needles and were successful, that the ones that had more sessions were more likely to complete the program. I could never predict who was going to take the needles. Some people, when I was saying that it really helped the outcome, they would say, "Oh, well, that's just the good patients," and that wasn't the case. There was nothing that would predict who would use the needles and who wouldn't. But I definitely could predict who was going to not be successful in the program based on their attitude about not being able to smoke. And so those who really were angry that they couldn't smoke, they were much more likely to drop out. And those who realized that this was a serious problem for them and they needed help, they were much more likely to complete the program. But we found that if we could convince the people who really wanted to smoke to use the NADA protocol, they were much more likely to stay in the program. So the treatment acted kind of like a help with cravings. So that when they had a really severe craving and they really wanted to smoke, they got a treatment, and then they were much more likely to stay. So the people that got needles were much more likely to complete the program. Because when I did this, there was no research out there about it. I came up with my own scale. This was the things that the acupuncturist who trained me told me all the things this would help with. So I had this scale that the patients had to fill out every single day, and everyone had to fill it out, whether you were getting needles or not. And so I was able to come up with some really interesting data. This was during this period of these first 2 years where we were using this treatment. I had 21 people who absolutely refused the needles and 75 people who had the needles, but I made them all attend the group. And the group was 5 days a week, and it was considered a relaxation group. And so then this is data looking at the beginning of their treatment and after 5 weeks of treatment. And we found that overall, the people that got needles had improvement in general. But when I was very first looking at this data and breaking it down, I was kind of disappointed because I thought it wasn't doing anything initially. Because what I thought it was going to help with was cravings, using dreams, anxiety, depression. And so when I looked at those, cravings for both groups improved over 5 weeks. So both groups got better. Using dreams improved over 5 weeks for both groups. Depression improved over 5 weeks for both groups. There was no difference between people who got needles and who didn't. And anxiety improved over time, over 5 weeks with both groups. And so then I'm saying, oh, this doesn't do anything. But then I said, oh, wait a minute. These people are in a really good treatment program. This is like the best treatment program in the country. Of course they're getting better. That's really good. But then when I started analyzing the other symptoms, that's when it really showed up. So one that was really dramatic was this improvement of anger for people that got needles compared to the people who didn't get needles. This treatment program was somewhat of a modified therapeutic community where people called each other on their behavior, and that caused a lot of anger. So it was a very anger-provoking treatment in some sense. And we found that the people that got needles had significant improvement in their anger, and those who didn't get needles, their anger just got worse and worse. We also found that it really helped with concentration. Initially, I told them that this was a relaxation group, so really all they could do was sit there and meditate, or they could read quietly, or they could write letters if they wanted to. However, when I would go in and check, because I would just put the needles in and then a nurse would sit there in the room the whole time. And if I would go in and check on them, everybody's doing their homework. And so I said, how can this be relaxing? And they said, well, this is the only time I can concentrate. And so we found that it really helps people with focus and concentration. And then I found that I could use it in staff meetings, because when we had staff meetings where we were trying to get people to focus and concentrate, and instead they're talking about their golf game, if we got needles, we got people to focus and concentrate. Then this is a really big one. This is probably the best thing, because if you work with people in substance abuse, especially when you have them in a residential or a inpatient treatment, the biggest complaint is they can't sleep. And this is because of how the drugs have affected their sleep architecture. And so what we found was that the people that got needles reported significantly improved sleep over the people who didn't get needles. And also pain. And acupuncture is well respected to help with pain. And we found that the people who got the needles had less use of PRNs like Tylenol or Motrin, so they had less problems with pain than the people who didn't get needles. And then the other thing is, when you study acupuncture and you learn about Chinese medicine, you learn that this is really a balancing procedure. It's to balance and to help your body heal, its own instinct to heal. And so this is interesting to find out that people actually reported improved energy with the needles. So there have been some more studies since 2010. This is looking at outpatient. These are people who have self-selected NADA treatments. So everybody is in the treatment program, and some people chose to use needles and some people didn't. And what they found was that those who chose to use the needles had significant improvement in all of these symptoms, including cravings, depression, anxiety, anger, body aches, headaches, concentration, and decreased energy over time compared to those who didn't use the needles. This is looking at pregnant women who are using opiates and then are on methadone to help with that. And so they had women that got NADA plus methadone and versus methadone alone. This is a very difficult population to work with. And so they didn't have a lot of compliance with the people coming in for the NADA. Because, for methadone, you just have to come in for 5 minutes and get your dose. But when they came in for the NADA, they'd have to come in and spend 30, 45 minutes to get the treatment. But for the ones who did do the NADA, they could tolerate larger reductions in their methadone dose prior to delivery. And the babies had less problem with the neonatal abstinence syndrome. And so this is a really great study that I'm encouraging more people to actually look at this because it's a really great thing to help with that. This is looking at veterans who have substance abuse issues. So a lot of these people have post-traumatic stress disorder as well. And so they were comparing nada plus relaxation control. And this is what we recommend now, that people, when you're actually studying this, to compare it to another treatment. Don't compare it to sham, because sham acupuncture actually does something, and it's so different. It's difficult to really tease out exactly what the acupuncture points are doing. So if you compare nada to something else. So this was a weekly session where people learn techniques to relax on their own compared to usual care. And then they found that they both worked equivalently, like nada and relaxation control worked. They were both effective. And so they recommend that you do both. And I totally support that, because the nada protocol is something somebody has to do for you. And so it's important that they also learn skills that they can do themselves. This is something I published because we did an outcome study trying to determine if we were saving the state money, and which we found that we were. And when I was doing the study, I found that we had really significant benefit with people with borderline personality disorder. It was totally against what was in the literature. Most literature shows that this is the group that is most likely to drop out early and the most likely to not be successful. And so we found that we were really successful with people with borderline personality disorder. They actually were more successful than the people that didn't have it. But we also found out that they got the NADA protocol more than anyone else. They also had the best outcome in terms of tobacco. And I think that was because they got the NADA protocol more often than anyone else. So I actually do believe it's like the gold standard for treating people with borderline personality disorder, a tool in that toolbox. This is a study out of Sweden, just looking at outpatients and their protracted withdrawal and how it really did help with that. So it's more of a qualitative study. This is interesting because it shows that it helps with staff, and we're finding this is a really great tool to help staff. We've especially found it during COVID, where nursing staff are overwhelmed and really they're having a lot of burnout. And so we have hospitals in Colorado where they've hired these people to come in and give staff treatments. But what this study showed, this is looking at people who work in surgical burn ICUs, trauma ICUs, which is a really difficult place to work because you're really hurting people. I mean, you're having to debride them and they're screaming, and it's a very stressful place. And so they found that if they gave these people NADA protocol, 5 sessions over a 6-week period, and they sat there for 25 minutes, they could significantly improve anxiety, burnout, and compassion scores. This is another study, and this was looking at people that are not substance abusers. So they do not have a problem with substance abuse. They just have a problem with anxiety or major depression. And they found that if they gave them NADA 2 times a week for 2 weeks, they compared that to another treatment called progressive muscle relaxation. They were both effective. The problem with this study was there was no control for usual care. And that is something that you have to remember. So if you're doing a study, you really kind of have to have at least 3 arms. So you're comparing NADA to another treatment to usual care. This was out of Sweden, I believe. These were looking at comparing the NADA protocol to CBTI, which is cognitive behavioral therapy for insomnia. And so these were people that were had chronic insomnia for greater than 6 months, and they were taking Z drugs, which are things like Ambien, Lunesta, Sonata. And they got NADA 2 times a week for 4 weeks for 45 minutes. And they found that they both significantly reduced the insomnia severity index score. They found that the CBTI was superior to NADA in terms of changing dysfunctional beliefs about sleep, which makes total sense. And it would have been interesting to see if they combined the two treatments. They didn't do that, but I would hypothesize that using NADA plus CBTI would have even better improvement. And finally, we have now a study. I just think it's interesting. Most pharmaceutical agents that we use start with benchtop research, then they go to animal research, then they go to human research. In the NADA protocol, we've started with human research, and now we have an animal model. So this is a group out of New York. I think it's Columbia University, where they have actually found that the ear in the rat is very similar to the human, and you can actually find the NADA points in the ear of the rat. And so they looked at two things. They looked at one they call locomotor sensitization, which is equivalent to cravings in humans. And then they looked at tolerance to pain and how NADA helped that. And it's a very confusing study. I'll kind of try and walk you through this just to help you understand it better. But I encourage you to look at all these studies because this is really exciting. What the locomotion, the sensitization study is, they basically have rats in cages that have cameras on them. So the cameras are monitoring the amount of movement they're doing. And so on the y-axis over here, it's the distance that the rat travels when they're in the cage. And they start by giving them morphine, 10 milligram per kilogram, and they give them 4 days worth. And then they have a lag period when they're not getting any. And then on day 11, they give them half the dose. And so what this is showing is that when they give them morphine for the very first time, they tend to be very sedated and they don't walk around in their cage. So that shows that the morphine works. However, the second injection, they're moving around more, third more, fourth more, compared to the rats that got saline. And then the 11th day, they're moving around a lot. So it's basically like these rats are going, where is it? Where is it? I need it. I need it. I want it. I want it. So this is like cravings. And so this is just showing where the points are in the rat's ear. And then what they do is they give these rats acupuncture, either the NADA protocol or sham, which is on the helix. And they give them acupuncture day 13, 14, 15, 16, 17. And on day 18, they give them a small dose of morphine. And what this shows is the rats that got morphine are running around the cage. The ones that got morphine plus sham are running around the cage. And the ones that got morphine plus the NADA protocol are not running around the cage as much. And this is all compared to saline. So that shows how it may help with cravings. And then this is looking at development of tolerance and pain management. And so this is very confusing, but these animals are getting acupuncture or sham on day 1, 2, 3. And then on 4 and 5, they're given a whopping dose of morphine. And then they get baseline number 2. And so what this is studying is paw withdrawal latency to heat. So they shine a hot laser on their paw and they measure how fast they move away from that. So that indicates it's painful. And so on baseline 2, this is paw withdrawal latency. All of them are pulling their paw away pretty quickly. However, on day 6, when they give them the small dose of morphine, if you look at these triangles, this is morphine plus NADA protocol. they are not pulling their foot away. Compared to pure morphine with no acupuncture, they continue to pull their foot away as fast as they can. So this is showing that these rats have already developed tolerance to the morphine. It's no longer working. They're in pain. And the NADA protocol is helping with that pain. So their recommendation is that if you do need to put people on opiates, then you probably should also use the NADA protocol to help them with the developments of tolerance. So all these studies have been reviewed by myself and a colleague in this publication. So we have this organization in the United States. It's a not-for-profit entity. It used to be based in Laramie, Wyoming. It's now in Maryland, and it functions as a training and education and advocacy organization. And so we advocate to change state laws to expand the scope of NADA, and the states can really vary. For example, in Hawaii, only acupuncturists can use the NADA protocol, so not even physicians can use it. In many states like California, Florida, only acupuncturists or physicians can use it. We've had about, and I think now it's even increased, we have a few more states have adopted some form of an ADS law. And in Colorado, we've gone through 3 law changes, and now in Colorado, we can train any professional, so anybody. And so I've trained county commissioners, I've trained peer coaches, so people that are in recovery that have gone through the training to help their peers, they can do that. Some states are very restrictive in terms of supervision requirements. In Colorado, we require no supervision. And so the NADA trainings are performed by registered trainers that are approved by the organization. We have classroom training. My trainings are usually 3 days long in classroom, and then they also get a lot of reading assignments. And then we have experiential learning, and then they have to have a supervised practicum. So they have to have 40 supervised treatments, and then somebody becomes an ADS. And I also require people to attend 1 or more self-help groups where they have to write a reflection paper after that. And I do that mainly because I've just trained so many people who work in the behavioral health field, like people who are addiction counselors, who have never been to a self-help group like AA or NA, and still they tell people to go to them. So I want people to experience that. The training does emphasize that it's only 5 points in the ear. This is a standardized protocol, therefore it's not really acupuncture, because as you all know, having done this, acupuncture requires a diagnosis and a determination of points. We don't do that. The only Chinese medicine diagnosis that people learn in this training is empty fire. And so the standardized protocol is used to treat that empty fire. And so basically people are experiencing a lack of calm inner tone, which is because they've got a depleted yin, and then that causes the yang to seem to be overactive, although it's not really out of control, it's unbalanced. And so what we train people is the empty fire in Western medicine, the tendency is to throw on drugs like benzodiazepines to put out the fire. But the reality is that just makes things worse because it further depletes the yin. And so the acupuncture is really helpful because it balances the yin and the yang, restoring inner calm. So we also emphasize clean needle technique, universal precautions. People learn the points and how to handle needle shock if it should occur. And basically, we want people to follow state laws. And we have an ethics pledge where people have to pledge to follow what we recommend. We also use beads and seeds as acupressure points. I have this picture here. Mainly, it's a great story because I trained someone who worked in a primary care facility, and so she was a behavioral health person. She was working with a gentleman who had chronic pain and chronic trauma, and so she was seeing him once a week to do trauma therapy, and he would get needles once a week, and then she would put a seed on his Shen Men point for the rest of the week. And so he asked her at one point, well, what does this grow into? And she said, well, I don't really know, but I imagine it's a beautiful flower. And so at the end of the year of their sessions, he brought this pot in, and he had apparently been taking the seeds off and planting them, and some of them germinated. And so this is what came out, which I think is a wonderful story. And so then we also go through what the functions are, because we have a very brief training in Chinese medicine, which really helps you understand why it takes so long to go to acupuncture school. You can't possibly grasp your mind around it. But I like the fact that traditional Chinese medicine is really more about prevention than it is about our Western medicine, reductive medicine techniques. And the fact that all of the points have a physiological, but a psychological, emotional, and spiritual aspect to them. And so they learn what the points are for. And then this is another study that kind of a review that I recommend reading about changing the laws in states if you're interested. The kind of places we've been using it in Colorado are the harm reduction centers where they do needle exchanges. That is a phenomenal place to do it because I've seen so many people move in their stage of change there, where they're sitting there feeling so relaxed. They start asking people, well, how do I get off this stuff? And so I've witnessed peer coaches working in these facilities where they start telling the clients things like, well, I did methadone and this is how you do it, or I did buprenorphine and this is how you do it, or I did treatment and this is where you can go get treatment. We also use it with the medication-assisted treatment programs because it's very helpful getting people adjusted, especially to buprenorphine. I found that sometimes it's hard to get somebody on to buprenorphine because you tell them they have to be in withdrawal before you can start the dose. And they come in and they're not really in withdrawal, but they think they are. And, they pretty much convince you need to start, and you start and you throw them into full-blown withdrawal. So I found that if you use this needle protocol first, you can actually really get them to the point where they're ready for their first dose. And so we have many places now that are using it in primary care settings where they use it as a crisis intervention tool. We've used it in emergency centers and hospitals where people are coming in acute withdrawal. This is something you can offer somebody other than offering them a kind of opiate. Inpatient treatment programs are using it, outpatient. We're using it for first responders, for stress management, and many people are using it in their private practice where they're doing outpatient trauma therapy. Right now, the NADA organization is in turmoil because we've had a change in board and a change in location, and there are some significant problems right now with the organization. And so many people are looking at other organizations. And this is another organization in the United States that also does the 5-needle protocol. And they can train pretty much anybody as well, depending on the state laws. And so it's wonderful that we have so many opportunities now to expand the use of this really effective treatment. I mean, the biggest thing about this is it's very inexpensive, it's effective, and it has minimal side effects. So my point is, why would you not be using it? All right. That is all I have. So I'm happy to take any questions or anything you might have. Hello?
I'll ask the audience if you have any questions. Please come now.
Hello.
Hello?
Yeah, I'm Akhil Jayamaha. What I need to know is, are there any other acupuncture points other than the ear points? Because Sri Lanka, we don't use ear points as per my knowledge, because we plan to conduct a study to incorporate acupuncture as an add-on therapy for the relieving pain and improving their sleep quality and physical activities and behavior and the psychological symptoms. From we are designing our study with acupuncture students. I would like to know, are there any other points other than the ear points?
Well, I'm not the best person to ask that because I am not an acupuncturist. I am a psychiatrist. And so I am limited to these 5 ear points. And most of the research is done on the ear for addiction. And there are NADA organizations around the world, like there's NADA Denmark, NADA Norway, NADA Austria, NADA Germany, and they all use these 5 points in the ear. And there have been many studies coming out of those countries. I'm sure there probably are other points, body points, but I can't answer that question myself. I really encourage you to learn the ear points, at least these 5 points, because it's very simple and very easy to use, and it can be transported anywhere. So the person doesn't have to come into the clinic. There's people using them because I just actually did an event in Colorado, opiate overdose event. It was in a park and there were 112 people there and everybody's getting needles in their ears in the park. And so that's something I encourage you to look into.
Excuse me. Hello.
Hello, yes.
I have a question, madam. Uh, are these all points used only together?
Are they used for who?
These 5 points. I mean, these are 5 auricular points. Are they only using together? That means.
Yeah, we use 1 to 5 points. So the patient is in charge. If the patient only wants 1, they can have 1, but we can't use any other of the points in the ear. Like there's, the whole body is represented in the ear, but we use the sympathetic, Shenmen, kidney, liver, and lung on both ears. And you can use 1 to 5 points. Normally, what we find is, this isn't research-wise, but it's anecdotal, that everybody seems to have one ear that hurts worse than the other, and I think that's about balancing because we're trying to balance people. And the other is that they have points that hurt more than other points. And it's just interesting, when they say, why does that hurt? Then you ask them. I found that smokers, the lung point tends to be the one that's most painful. People that have hepatitis C, the liver point is the most painful. But then again, if you're looking at emotional qualities, if people have a lot of grief or loss, then it's the lung point that's the most painful. It's really interesting to kind of observe all that.
Hello, I just have 2 questions. The first question is, what is the duration of the total program? Like, for example, for one session, how long is the session, and then how long do you use the acupuncture or this Sheng treatment in one session?
Okay, that's a very good question. The treatment, a patient sits normally for 30 to 45 minutes with the needles in the ear. And there usually is an immediate benefit. If somebody is pretty healthy, like they don't have anything going on, they may not notice an immediate benefit. And usually that benefit shows up later that evening where they sleep better. However, what I've found with people that are acutely ill or acutely in withdrawal, there is an immediate benefit. Most people end up falling asleep and snoring for 45 minutes. Then they wake up and they feel much better. And so then the other thing is you have to do this on a regular basis initially. And so the recommendation is for optimum treatment that it be available 3 to 5 times a week. For the research, like looking at smoking cessation, for example, most of the literature shows that you need to have it at least 3 times a week to show some optimum benefit. But then it doesn't have to be forever. And so, like in my treatment program, we offered it 5 days a week, and initially people would take it 5 days a week, and then they cut down to 3 days a week, and then to 1 day a week, and then maybe once every other week, and that seems to be the best way that it works.
Thank you very much. And my second question is now, in some cases, acupuncture is contraindicated during pregnancy. So, how are we going to manage acupuncture treatment in this case?
Well, yes, I've seen the research that says that it's contraindicated in pregnancy. That has actually changed, and there is no contraindication for pregnancy for these 5 points because we're not doing anything that would trigger any problem with pregnancy. In fact, the Lincoln Hospital had a mothers and children's program where they treated hundreds of pregnant women without consequence, and they actually have data showing that it improved the outcomes. And so Ralph Rabin is a OBGYN physician in Germany, and he has published on this as well. He says there's no contraindication to using the NADA protocol in pregnancy. So he treats many pregnant women in Germany with the NADA protocol.
Thank you very much, Doctor.
So,
Okay.
madam, I have a question. I'm an acupuncture undergraduate student, and I need to know, like, if I need to use the NADA protocol, how can I approach that, and how can I learn about that in
Well,
Sri Lanka?
many acupuncture schools in the United States have incorporated a NADA program, so training people in the NADA protocol specifically. And I would encourage your school to consider doing that. There are many people you could contact in that regard, and that I mean I just think that would be helpful to incorporate in your school. The other way is
We don't
somebody.
actually have it in Sri Lanka. Is it possible to?
Pardon? Could you repeat that?
We don't actually have that in Sri Lanka. Is it possible to learn it online?
Well, it's an in-person training. I mean, it's very hard to do that online. We have done during COVID, we had people doing some of the didactics online, but they still had to get together to learn the protocol and, practice it and show that. So, I mean, I suppose if someone wanted to come to the United States, they could take the training here, but that's a very long way to do that.
Okay, madam, thank you.
Thank you very much, Doctor. Do you have any more questions to ask from our honorary speaker?
So, doctor, if I may ask, this is Nimesha here. So, if I may ask, in Sri Lanka, so for treating substance use disorder or in the rehabilitation process, so we currently is not officially incorporating acupuncture as a treatment intervention. So, if you are starting it in here, in let's say for an example to the residential rehabilitation, so if we are trying to incorporate it, like so what should we do, like should we start from should we start from applying it to the detoxification process, to the withdrawal, or we can just actually incorporate to the all the stages of the rehabilitation?
Well, it could be
What do you
incorporated.
recommend? What
I
do you
mean, I
recommend? Should we go for by stage, or like just incorporate into the all three stages of rehabilitation?
I would recommend incorporating it in all stages. One of the things that I discovered in my treatment program, my treatment program, since most of the people were coming in as probation, condition of probation, they were coming from jail, so they didn't need to be detoxed. But with the opiate epidemic, we started seeing people coming in full-blown opiate withdrawal. And so I started using ear acupuncture to detox people. I didn't know it really worked, but I'd been told it worked. And so I used it with great success. The problem is you have to offer it at least 3 times a day. So you have to have staff members that are able to do that 3 times a day if you're using it to detox people. But then if you're using it to help with people in early recovery, then it's best if you offer it, daily as a group. Then, if you're doing outpatient, most places end up, only being able to offer it once a week because people come in only once a week. But then you can use the beads or the seeds to put on after they take out the needles. And so they can keep pressure on the points for the rest of the week. And those beads or seeds are on a piece of tape that then can, last for a week. So I just encourage you to incorporate it in all areas because, it's effective and helpful.
Okay, thank you so much, doctor.
Sure.
If we don't have any more questions, we can conclude the session now. Dr.
Okay.
Libby, we owe you a special vote of thanks for this valuable and interesting presentation. On behalf of the Ceylon Association of Medical Acupuncturists, I would like to extend a very hearty thanks to our honorary speaker for enlightening us on utilization of acupuncture for substance use disorders. I would like to extend my thanks to our participants, the members of the National Drug Regulatory Authority in Sri Lanka, and also the members of the AIUHEI cell. And thank you very much for all the participants. Again, thank you very much, Doctor, for willing to do this presentation for us. We are so grateful for you. So thank you very much, everyone.
You're very welcome.
Okay.
Thank you.
Doctor.
All right. Bye.
See you, Dr. Bye.
Bye.